As a country, we are preparing. It's a long journey. One thing we have to note with the 2019 nCoV is that even the most well-prepared and I would say well-set-up health systems are really not exceptionally ready for any outbreak. As soon as we had, talk about the new outbreak, the ministry set up screening points in all our ports of entry. So at least visitors who are coming in from China and other countries which potentially could have nCoV, they are all getting screened. If you go to JKIA, we are screening all of them, and any person who has fever, they get isolated so that we test them to just, to allay the fears. We also have, efforts by the ministry to set up mechanisms for quarantine, mechanisms for isolation, so that when we get these patients in Kenyatta National Hospital, for example, there is facilities that they use to isolate patients, and therefore that is some level of preparedness which can enable this country at least to deal with the case. Then we also have capacity building in terms of, training of health staff, and I know that has been ongoing from the level of the ministry. And we also have setting up of just diagnostic capacities in the labs. We have at least 5 labs in this country that have capacity to test for nCoV, and therefore, if we do have cases that might need to be tested, we have these labs which are able to do those tests. Kenya, just like many other countries, is prepared for outbreaks. Because in the 90s and even early 2000s, there's a lot of work which has gone into just trying to improve the epidemic preparedness by countries. We really need to invest on simple things. Infection prevention, hygiene, seeking treatment early when you are sick, hand washing, things like that. Those are some of the, their basic mechanisms just for preventing spread of diseases within the population.